It's 8:42. Now, people are finding it harder to see their family doctor. That's according to a new study from the University of Leicester.
Seeing the same GP has been linked to fewer hospital admissions, as we've been telling you this morning, and just generally feeling healthier.
Yeah, but the report says patients are finding it increasingly difficult to see their own GP on a regular basis compared with 5 years ago. Now, we've been to speak to a GP and some patients to find out what they think.
I have a regular patient base who prefer to see me, so they will come and see me whenever they can. Sometimes, unfortunately, because if I'm already booked up, they might find it difficult to see me, but majority of my patients are able to book in to see me within 1 week.
First, it was a bit strange because you get to know your GP and you develop a relationship. You don't really get that here, but on the other side, it is quite nice having a different aspect from a different GP as well, so negative and positives.
I would prefer to have the same GP dealing with my health problems, because I can build a relationship up and he would know my situation and I would feel quite pleased to talk to the same person.
Personally, I think that it is better at times to see different doctors to get a fresh view on the whole overall picture and to maybe change some treatment options for you and overall try and improve your health.
Well, we're joined now by the report author, Dr. Levene. Thank you very much for joining us this morning. Obviously, you've done all the research into this, and we heard a bit about some patients and doctors there saying what they think. What do you think is the overall theme here? Obviously, we're not able to see our doctors as much as we like, not as regular in terms of the doctor we actually see. So why do you think this is?
Well, there's probably two main reasons why. The first is that, there's a fragmentation of the workforce in the service. There are fewer full-time permanent GPs working. There are now alternatives to seeing the traditional GP surgery, such as walk-in centres, internet doctors. And secondly, the workload has increased dramatically. And people, when they're faced with a choice between either just getting an appointment or seeing their preferred doctor, are going to opt for getting the appointment.
Yeah.
Sometimes can seeing a different GP bring a positive, a sort of different perspective, maybe on a sort of long-term complaint that you might be having?
Yes, I think a fresh set of eyes, does, give the possibility of detecting something that the usual GP may have been missed or might be slower to pick up. But at the same time, continuity does have advantages, and without overstating them, patients who are able to see their GP more regularly are more likely to take their medication, more likely to take up health screening. And there has also been research to show that greater levels of continuity are associated with fewer hospital admissions as emergencies.
Is there a generational difference between this in terms of what people want? Like, are younger people less bothered about seeing the same people and older people are, or anything like that?
Possibly, but I think it also more ties into the nature of the problem. I mean, if somebody has a fairly simple, straightforward problem like a urinary tract infection or a sore throat, they really just want to see somebody who's competent in a timely fashion. Whereas if you have a more complex, long-standing problem, you're going to tend to prefer to see a doctor who is familiar with you and with the problem.
Is there a simple solution? I mean, we're always talking on this programme and people are always saying the NHS is under so much pressure, time, money, whatever it might be.
Yes, I think there are solutions. The first thing I have to say is that there's probably some more research that needs to be done at individual practice level. But whatever solution is undertaken has to improve overall access to the GP, and that means that practices' capacity, their ability to offer sufficient number of appointments has to be there. If you don't have that, then you're not going to have continuity, and that may involve more resources, but it also may involve reallocation or removal of some work. I mean, for example, GPs have to do quite a lot of administrative work, and there might be potential to reduce that. So there are ways of dealing with this.
Yeah, interesting. Thank you so much for coming in to talk to us about it.
Thank you for inviting me.
Really appreciate it.
The Department of Health says the latest statistics show more than half of the population is currently benefiting from more flexible appointments. To improve availability, it's investing an extra £2.4 billion a year into general practice by 2021 and will recruit an additional 5,000 doctors.